Good Saturday morning, everyone. Today on Perspectives, last year 2020 was considered to be the most disruptive in the history of the COVID-19 pandemic, according to USA Today. Unfortunately, though, this year 2021 has proven to be the virus's deadliest year. Now, this morning we will get the latest information on the fight against this deadly virus and its variants with one of Mobile County's top local health officials. Now, the fight against the pandemic in America continues, of course, and according to the latest news reports, the U.S. world-leading total of coronavirus deaths has gone now over more than 700,000 mark. Last year, the death tally was 352,000, or half that number. Health officers are now doing and saying that the number of COVID-19 cases concerning deaths and hospitalizations in the U.S. are now trending downward, and that's according to the latest news reports. Graphic full more than anything else, health officials are saying now the best way to combat the virus is to get vaccinated. The Centers for Disease Control saying now that vaccines continue to be highly effective at preventing hospitalizations and death, especially with the new adversary in this pandemic, the COVID Delta variant. Health officials say now that the best prevention is to get vaccinated and, of course, to wear masks indoors in public spaces to reduce the spread of the Delta variant. As resistance to the vaccine continues, though, for some, nevertheless, President Joe Biden is now ordering federal workers to be vaccinated against the virus. With just weeks remaining before the federal workers must be vaccinated against COVID-19, the federal government outlined procedures for employees to request medical or religious exemptions from the president's mandate. Federal workers have until November the 22nd now to be fully vaccinated. Joining us this morning is Dr. Rindy Murphy, the Mobile County Health Department's epidemiologist. She will give us the latest information on the fight against COVID-19 and the Delta variant that has proven so deadly in our community. We've got the latest information for you on the fight against COVID-19 for you as Perspectives continues after this quick break. This morning on Perspectives, we're speaking with Dr. Rindy Murphy with the Mobile County Health Department. Dr. Murphy, welcome to Perspectives this morning.
Thank you. Good
to have you as we're looking, of course, still dealing with the coronavirus and in the midst of the pandemic. A doctor in the Northeast, Dr. Megan Rainey, is saying that we are not out of the woods as of yet, and I fully expect cases to go up across the country over the weeks and months to come. Give us your assessment of where we are in Mobile County and, of course, the state of Alabama.
Well, right now, things are looking better. We had a very, very difficult, very challenging, very high number of COVID cases and hospitalizations and deaths in July and August, and we're just now coming off that record-breaking wave of COVID infections that were driven by, the Delta variant being 95 to 99% of the infections in Mobile and Alabama and across the nation, really. And the fact that Alabama and Mobile County has very low vaccination rates right now. But things are getting better. The numbers of hospitalizations are going down. Thankfully, we're seeing them under 200 a day for the first time since early August, I think August 7th. The number of cases reported to us is going down. So we're definitely not out of the woods yet. We still have very low vaccination rates. The Delta variant is still with us, highly infectious, highly transmissible. So we're just trying to say things are better. We're happy that they're better, but we are definitely not out of the woods yet.
Just 2-3 weeks ago, we had the holiday period for the Labor Day 4-day weekend. Are we through seeing the surge from that, or are we still expecting some results of that as well?
Well, if we were going to see a surge in cases due to Labor Day and activities, travel, gatherings, that sort of thing, we would have seen it already. And much to my surprise, we have not seen a post-Labor Day spike. Now, this is a little confusing to me, and many public health officials and other medical personnel and scientists, because, we all saw it on game day, right? Stadiums full,
Yes.
beaches full, and we did not see a spike in the number of COVID cases. So I'm a little concerned or unsure what to think about that. Certainly we're glad, but we just have to keep reminding people, please, keep wearing your mask when you're around people that you don't know, and maintain your distance, particularly when you're indoors. So it looks like we're seeing just sort of a natural combination of vaccination and layering other protective measures, and then sort of just a natural progression of the very high large outbreak that we saw in July and August, slowly coming to an end, hopefully.
This is still something that we're learning in progress as we experience these different variants. Now, just a couple of days ago, Dr. Scott Harris, the state medical officer, came out and said for the first year in the history of Alabama where there are actually more deaths than births. Now, is that throughout the state, and is Mobile County experiencing the same statistical numbers, or are we not quite as bad as what the state overall has experienced?
Yeah, in general, we very closely mirror what is going on around the state. The minor exception is that this outbreak, this wave, this record-breaking peak of cases happened earlier than in most areas of the state. So I think that August probably will go down on record as being the month with the greatest number of COVID deaths. We had around 220 people die in Mobile County in August alone. If that holds up, I mean, it's like 1 in 5 deaths that have occurred since the COVID pandemic began affecting Mobile County occurred in August. So yes, we are seeing just a very disturbing high number of deaths that really is totally avoidable, or 91% of them could be avoided if people were vaccinated, because the overwhelming majority of people who are hospitalized and die with COVID are unvaccinated.
You mentioned earlier about the hospitalizations and, of course, the ICU beds being a concern. Even Dr. Harris talking about where we are as a state. How are the conditions here in Mobile County? Do we have beds available, or are we still very concerned about other issues that people may have that are non-COVID related?
We're still concerned. The hospitals are faring pretty well, all things considered. They've always battled staffing shortages. That has been a consistent theme throughout the outbreak. Nurses out with COVID, with family members with COVID, taking other jobs, other high-paying jobs, that sort of thing. So the hospitals are in better shape. So we don't have staffed ICU beds in other areas of the hospital, in the emergency department or in other areas like we had 3-4 weeks ago, but it's still many more COVID hospitalizations than we really need to have or should have because of the vaccine. So we're still asking people, particularly in the younger age groups, to please get vaccinated, even if you think you are healthy and not going to have a severe outcome if you do get COVID. Think about what your contribution to protecting your community, particularly those that are older or more vulnerable, about how you can help protect them, because we just need to give our healthcare system a break and try to get things back down to the very low numbers of hospitalizations that we were seeing in June.
Now, do we have any federal teams to assess our hospitals in Mobile County as they have other hospitals around the state?
Well, we've not had a federal assessment of our hospitals. There have been some consultations. We have been told that that a couple of hospitals in Mobile may receive some federal assets in the way of, temporary nurses for a 30-day period to assist. But I think right now things, like I said, are better than they were in July and August. And so hopefully this sort of COVID fog that has laid heavy over Mobile is beginning to lift, and hopefully we can, see some sun in the skies on our horizon.
Were you shocked when Mobile County became sort of the epicenter of Alabama during that period?
I was very surprised. It's it's almost like a light switch turned on the 4th of July holiday. When we came back to work on July 6th, ironically, that was the day that the statewide emergency order ended. And on July 6th is when we started seeing just the record number. Every day we were breaking records for the number of COVID cases reported in Mobile County residents. And I was just afraid to look at the number every day when the reports came out, because it just seemed like it kept getting higher and higher. At the peak, there were 2 days in late July, early August, where we saw more than 800 cases of COVID-19 reported in one day. And that just blew my mind and drove my anxiety way up. So I'm glad that things are getting better, but I just keep reminding people the importance of getting a safe and effective vaccine and layering in prevention measures. We have to keep doing that. We have to keep, masking and distancing and staying at home when we're sick or when we're exposed to try to slow transmission down so that we can get back to enjoying the low positivity rates, the low hospitalization rates, the low number of cases reported like we saw in June and May.
A very special guest this morning, Dr. Rendy Murphy. We're going to take a quick break here on Perspectives. Dr. Murphy, and we come back, we're going to talk more, including what about our kids who are back in school. Perspectives continues in just a moment. Welcome back to Perspectives. Our guest this morning, Dr. Rendy Murphy with the Mobile County Health Department. And of course, we're talking about the coronavirus pandemic. And Dr. Murphy, you talked about the importance of the vaccines and how much of a difference it makes when we look at the numbers of people who are being hospitalized and, of course, the deaths in our community. Now, we've had a lot of shots and doses given, over 349,000. And we talk about now the number of people completing their vaccine series, more than 161,000. But yet, we're only about 39% of the population vaccinated. How do we get those numbers to improve? Because the state itself is one of the worst in the top 3 as well. So how do we get folk to the number where you're hoping for at least closer to 70%?
Well, that's a really good question, and one that we've been struggling to answer ourselves. I am really surprised that the majority of people in Mobile County have elected not to get vaccinated against COVID-19. Back in the spring, I would have never guessed that there would be such widespread vaccine hesitancy in Mobile County, particularly because there have been hundreds of millions of people vaccinated in the United States with very few truly severe adverse reactions. So it is a safe vaccine. It's been proven extraordinarily effective at preventing hospitalizations and deaths. 85% of the people in the hospital are unvaccinated. 90+% of people who die with COVID are unvaccinated. So we have taken lots of different approaches. We're trying to get the message out in different sorts of media, TV, radio, billboards. We try to do things like our Facebook Live updates to try to reach people and answer their questions and talk to them about hesitancy. We try to make the vaccine as convenient as possible to try to help people if they're just, out running an errand, okay, I'll just, stop by the health department and get a vaccine today. So we've tried mailings. We've partnered with the people who have done incentives. So we continue to try to change the message up, to change the delivery of the vaccine, where we go, who we target. Tried to partner with, trusted leaders in the county, faith leaders, political leaders, community workers, community-based organizations, that sort of thing. So we have been trying a variety of things, and I think it's going to come down to just, one-on-one conversations with people to try to talk with them about the reasons that they, have not taken the vaccine, and see if some conversation maybe with a trusted pharmacist, maybe with a doctor, maybe with your dentist, maybe with your child's teacher or administrator, to someone that you trust, to talk about why it's important to take the vaccine and how safe the vaccine truly is.
Let's talk about our children. They are back in school, and of course, we are getting cases of the kids. More than 50 kids hospitalized throughout the state with COVID-19, kids on ventilators. How are we doing overall in Mobile County with the numbers, as well as how serious of a infection with the virus?
Well, it's been quite tense and difficult at sometimes. Things are better right now, but during July and August, it was very sad to see so many children hospitalized, many of them on ventilators, several very young children who lost their battle with COVID because they had underlying medical conditions that made it really difficult and for them to survive these combination of factors. So right now we're seeing about 20 to 25% of the cases that we see are in children, so people less than 18 years old. Of course, some of those 12 to 17 are already eligible for vaccination. So we see sometimes maybe one or two children who've been vaccinated that required hospitalization. So it is true that younger age groups are driving this wave. The wave that we're in currently is being driven largely by younger people who are mostly unvaccinated. And for children that are less than 12 that aren't even eligible for a vaccine at this point, I talk to a lot of parents and teachers and schools to say the best way to protect those vulnerable children are by getting the people around them vaccinated. So if in your household, if you have vaccine eligible children or adults or grandparents or aunts and uncles that sometimes babysit or pick up kids, make sure all those people are vaccinated. And then again, layer on those protections to try to protect those who are too young to be vaccinated by having them wear masks and keep their distance from people that they don't know.
We are entering another period of the seasons here where fall is upon us, and of course already the conversation about the flu season, and some of the national doctors, as well as Dr. Scott Harris, is saying that everyone 6 months of age and older, with rare exceptions, he says, is advised to get the flu vaccine every season. And we're expecting possibly a worse flu season, according to some, this year because of the mix with the virus. What are we expecting here, and are you encouraging the same as Dr. Harris to get a flu vaccine?
I almost always agree with Dr. Harris. So yes, you should definitely get a flu vaccine. As you stated, anyone 6 months and older should get a flu vaccine. You can get it at the same time as you get COVID vaccine. And this is really important because when COVID vaccine first started rolling out, they were asking people to not get a vaccine for COVID within 2 weeks of any other vaccination. And that is no longer the case. So you can get your flu shot with your COVID shot, or get your COVID shot with your shingles shot, those sorts of things. There's not a recommendation to avoid that. So yes, it's super important to get your flu shot this year, as it is every year. And last year, because we had a lot of schools closed, we had a mask mandate, there were other restrictions on gatherings and that sort of thing in Mobile and Alabama, we really did not see a flu season last year. We saw lots of COVID in December and January and in February, but we saw very little influenza and other respiratory viruses that circulate during our typical seasonal influenza season that runs roughly October through April. This year, since schools are back in session, there is not a mask mandate, there are no restrictions on gatherings, indoor or outdoor. That is what has us really concerned about what might happen this year. So without some of the controls and preventive measures that we had in place last year, I fully expect that we are going to see a robust flu season, and potentially the mixing with COVID could make things look very bad this year.
Dr. Randy Murphy, Mobile County Health Department, we thank you for spending this time with us this morning, and of course, continuing to press forward that message about vaccinations, as well as the other things that will make a difference, like mask wearing and still social distancing in our community. We thank you this morning.
Thank you.
And for more information, you can always check out the Alabama Department of Public Health website. For general COVID questions, you can also call 1-800-270-7268 or email covid19info@adph.state.al.us. Next up on Perspectives, when was the last time that you thought about how what happened here changed the world? The civil rights movement changed America as American activists, black, brown, and white, fought tirelessly for our fundamental freedoms so that we and future generations of African Americans could enjoy a life so much better than the decades before. Next Saturday, we talk with the author of the book, The U.S. Civil Rights Trail. It follows a timeline of 36 major events, 120 landmarks across 14 states, including Alabama, capturing vivid moments in a time in a journey towards civil justice. Well, please join us here next Saturday morning for Perspectives as we discuss those important issues and seek solutions. I'm Eric Reynolds. You have a great week ahead. We'll see you next Saturday morning.
Thanks for watching Fox 10 News. Watch us live wherever you are, on our mobile, our streaming news app, and you can also watch us on Roku, Apple TV, and Fire TV.